Hi, my name is Dr. Monique Barbour. I'm an ophthalmologist in Lake Worth, Florida. And what does an ophthalmologist do? Well, to put it simply, we are the eye surgeons. We are the doctors who can operate on your eye to restore vision or alleviate other problems that you may have. A little bit about me. I'm from Washington, D.C., where I attended elementary school just steps away from our nation's capital. I attended middle school and high school in Washington, D.C., which was a specialty science and math high school where I got my interest in becoming a doctor. I went to college at St. Augustine University in North Carolina, and after that I attended Howard University Medical School in Washington, D.C. During medical school, I became exquisitely interested in the eye and how that organ works. And I decided that yes, the eye is simply the most amazing organ in your body. Where else can you form an image that goes to your brain and then you're able to perceive things in space? So as I became interested, I gained more and more confidence, and I decided that I wanted to become an ophthalmologist. And that's where I am today, practicing. As a teenager, my most dear cousin of 15 years of age was involved in a car accident, unfortunately. His eye was injured, and I felt so horrible about this situation. It was truly tragic. At that time, things were difficult to control. I accompanied him to the hospital where doctors found that a piece of glass had shattered his cornea. As I watched the doctors work on his eye, I began my fascination with ophthalmology. And it was that single event, I would say, that piqued my interest and led me into this field. So what's a typical day like for an ophthalmologist? Well, let's take a journey through the office. So typically, our patients will come into our waiting room to be received by my office staff. And after that, we will take our patients to the back office for diagnostic workup. So we will bring our patients to one or two of our workup rooms. In this workup room, we have our standard ophthalmology equipment to examine the patient, including the projector, which shows the patient a series of letters or numbers and asks them to identify so that we can kind of see what their visual acuity is like. The next thing that we would do is take a look with this machine here, and this is called a slit lamp, and it allows me to have an up-close magnified look at the patient's eye so that I can diagnose what the problems are. Another instrument that we use is called the phoropter, and this is what we use to get the final prescription for glasses. So typically we will start with showing the patient a series of letters or numbers through the projector, which shows the image on the wall behind me and allows the patient to identify the characters as they get smaller and smaller. We will then use the phoropter, this instrument here, which some of you may have seen if you've been to see the eye doctor. We will put various lenses here to make the lenses stronger or weaker so that you can see clearly. So after a thorough workup, we will then bring you to a room like this where we do some diagnostic testing. So one of our workhorses is called the visual field machine. With this instrument, we ask the patient to put their chin here as they look into a bowl where they will see lights flickering. As they see the lights flickering, they will then press the button, and that allows us to make an assessment as to how the optic nerve is functioning. Typically, when patients have a condition called glaucoma, they are asked to perform on this test, and it will manifest and let me stage the disease so that I will tailor my treatment accordingly. After properly diagnosing the problems, I will then tailor a treatment plan, and quite often that treatment plan may involve a laser treatment. So this laser, for example, is our coagulation laser, and it burns things. So typically, if you have glaucoma or diabetes inside of the eye, I can use something like this to treat that problem and get rid of bleeding, for example, inside the eye, or lower the eye pressure. With this laser, this is called a YAG laser, and we typically treat patients that have something called a narrow angle. Or after cataract surgery, sometimes the implant can get cloudy, and we use this YAG laser to open the implant up. So quite often, when a laser treatment is not enough, or if there's another kind of issue that requires kind of a major eye surgery, we can use a room such as this one, which is our surgical suite, where we undertake those kinds of issues, such as laser vision correction and surgery to remove a cataract from someone's eye, or a major eye surgery to lower the pressure in the eye in the case of glaucoma. Sometimes patients want to lift their eyelids also. So in this kind of suite, we can perform surgeries to lift the eyelids and improve the vision in that manner. So you've seen the office from the start to where we are now. We take the patients in, we do the workup, and that shows me what I need to do. We do the diagnostic testing, which is critical in allowing me to make a full assessment. After that, we bring the patients to a room like this where we can perform treatments and surgeries to improve their life and better their health. So just to recap, I've shown you every aspect of what practicing ophthalmology is like. In short, I am a medical doctor, a physician, an MD, who attended medical school, and I deal with all kinds of morbidities such as diabetes, glaucoma, high blood pressure, so forth and so on. That allows me to take complete care of the patient, including care for their eyes. You might ask what I'd like to do for fun. Well, I'm not here on the weekends, that's for sure. So quite often I spend my time enjoying music. Specifically, within the last year or so, I've been learning how to play the guitar, and I absolutely love it. When I'm playing, it relaxes me so much and relieves most of the stress and things that I worry about during the week. I can also dig up some old tunes that I learned during my childhood and learn to play them easily. So let me reiterate the fact that it's so important to have a balance in life. You should have great working skills and an amazing work environment, along with having fun activities to balance things. I am so proud of all of you students who are considering a career in the medical field. Let me give you a couple of pointers of advice. Number one, set your goals high. Your dreams are obtainable. Number two, work hard for what you want. You won't be disappointed. Third, do not let finances get in the way of your dreams. There are so many wonderful resources out there to help you obtain your goal. Scholarships, fellowships, research stipends, so forth and so on, are in place to help your generation get to where you want to be. Take a look at the T. Leroy Jefferson Medical Society. They have numerous programs to assist you in getting all of the financial help you need, as well as finding a mentor to guide you through your career planning process. There are also several foundations right here in Palm Beach County that are willing and able to help you.